Hi there, my name is Carlos, and today we're going to be doing some post-operative exercises and some education as well. So just kind of a couple of things that we're going to be going over. We're going to be going over diaphragmatic breathing. We're going to go over the huff and PEP therapy. We're also going to teach the patient how to control their cough, and we're also going to do range of motion exercises that they need to do. And then also we'll be teaching them how to log roll or just kind of move into the bed when they need to after surgery. So first couple things I need to get is some supplies. So I don't have an incentive spirometer. We're going to pretend that this is also the PEP device. And then also I have a pillow, which I will be using to show the patient what exactly they will need to do. So now I'm going to go ahead and go in. I'm going to wash my hands. I'm going to introduce myself. So this is my patient. This is James. He was born 10 years ago, and he's going to tell me his birthday. So I would go in, identify the patient, make sure this is the right name, right patient, and the right date of birth. So I want to emphasize that it's 2 patient identifiers. So first thing I want to do really is I want to assess the patient. I want to make sure that ask questions such as maybe like any history of smoking, just kind of things like that, recent surgeries they might have had. And then I also want to look at like labs, so like hemoglobin levels, maybe CBCs, chems as well. And just kind of assess in general, just assess their lungs, so I can also tell you. Also, I'm just going to kind of take a look in general in their extremities as well to note if there's any edema, if there's going to be any other issues like respiratory issues. So patient might have COPD, emphysema, they might just have bronchitis or asthma. So just things kind of to note. So I would auscultate first. And then I just kind of have him lean up and I'd listen to the back. So far he's sounding great. James is sounding wonderful. So make sure you go on opposite sides so that way you can compare. A little bit low, but okay. Oh, and before that too, I'd ask them to actually cough for me. So James, I'm gonna have you cough, take a deep breath and cough. You just cough. Yeah, again. Good. So now that I kind of assess the patient, things I want to kind of make sure too is I want to make sure that they don't have any clots anywhere. So I would check their feet, kind of put them together and compare them. In doing so, I kind of can get a better look and see. So is one maybe having more edema? Is one, more red than the other? Kind of things the way that I can compare. So now that I fully assess my patient, now I can teach them just kind of some surgery stuff or some post-operative exercises that they can do. So one of them will be diaphragmatic breathing. So in this example, what I'm going to have the patient do, James, what I'm going to have you do is that I'm going to basically have you sit up a little bit more, and I want you to put your hands like so, and you can have your middle fingers touching, but I kind of want you to be more on your abdomen. I want you to kind of push down on your abdomen as you're breathing. And while you do this, I want you to keep your shoulders and your chest relaxed, and I want you to take a big deep breath, nice and slow, in through your nose and out through your mouth, just kind of like so. Okay, so I want you to do that, and you're going to push down on it. As you feel this, you're probably going to feel your diaphragm, as it's called, diaphragmatic breathing. You're going to feel your diaphragm kind of drop as you do that, but this is good to also kind of help with expanding your lungs. So you just want to push down. And remember, in through the nose, out through the mouth. And you would do that about 10 times. Just kind of do some slow breathing like so. Okay? So that's one exercise that you can do to kind of help with expanding that, and this will help kind of prevent some like pneumonia and just kind of help expand that, expand your lungs, which is very much a concern after surgery. Next, what I want you to do is we'll have the PEP therapy. So we're going to pretend that this is it, right? And PEP therapy stands for positive expiratory pressure. So basically what you want to do is that this is going to be more about exhaling. So when you breathe in, you'll kind of do roughly the same breathing techniques that you want to do. But the thing is that when you breathe in, you're going to exhale a little bit longer than usual. This is because we want to clear out the lungs as much as possible. So you're going to kind of do the same thing in through the nose and then you'll just kind of push that out. And you'll kind of do that with this device too, and you would push into it and push out. So we would do that 10 to 20 times just to kind of have you breathe in nice and easy, and then just kind of hold it. And then you just force it out nice and quick, just boom, a little bit quicker than I did. So that's kind of what we would do for what's called PEP therapy, and kind of just some huffs. This is just to kind of clear out the lungs, and this is good because then it just kind of forces you to breathe out. So that's another one of the things that we do. Thirdly, what we're going to do is that we're going to have you demonstrate kind of like a patient-controlled cough. So when we do this, we want to take 2 deep breaths beforehand, okay? And on the third one, you want to hold your breath for 3 seconds roughly, okay? And when we do that, when you breathe out, you're going to cough 2 to 3 times, and I do not want you to breathe in between. So we just go 1, 2, 'Just like that, 2 or 3 times roughly. That'll help us. And this just kind of helps us clear out the airway, just kind of clear out any sputum that you might have. It just kind of helps us get that deep breath in so that we really can get down in there. And this is what we want to do. And we want to do this, surprisingly, I know that you're going to probably think it's a little weird, but we want to do this at least 3 times, probably possibly in the hour. I know that that could hurt, especially with your incision mark, but we also have the pillow here, which I can show you, is to use when you do that. You want to put this on your side, and this is going to be used also during turning. You can kind of use the pillow as a stent, and you can kind of push the pillow up against you, so as you cough, it kind of puts pressure on it, and that'll help you kind of control that pain a little bit better, and might hurt less when you cough. So that's just something you kind of want to focus on, just to kind of hold it. It's going to hurt, but just know that it's just going to kind of hold it down, and we can use it to kind of grasp over just gently, okay? And next, what we're going to do is log rolling. So when it comes to rolling on your side, it's going to hurt because of the fresh surgery, and we will try to help on our end with medications to help with the pain. But to properly turn and to also kind of avoid any openings of the wounds again, what we're going to do is that, so you're going to hug the pillow basically as so, and what we're going to do is that depending on which side you want to turn, James, if you want to turn right or if you want to turn left, you want to do the opposite end. So if you're going to turn right, you're going to have your leg bent up, kind of touching the mattress, and then you're going to reach over with your left arm, and you're going to reach over to your right side and roll. And then as you do this, you're going to be hugging the pillow. So if I'm going to turn to my right, do this, my leg is going to be thrown over, my left leg is going to be thrown over, and I'm going to reach over to the side and grab the handrail, the rails over here. And then from there, you're going to push your body up off, you're going to push your butt off the mattress and then turn as well, just like that. And you do the exact same thing when you're going to go to the other side of it. So these are very key because this helps us kind of avoid causing you pain and also any wounds opening up. And if that's, we want to try to do that every 2 hours. But if you're very tired or unable to, we can also kind of come in and help with the turning as well. We will do exactly the same things. So that was the second to last one. This is the last one, which is we want to do range of motion. So basically, while you're kind of laying down with your feet, we kind of want to have your legs kind of active, so that way you don't really just kind of atrophy up and lose all that leg muscle. So kind of some things we would do, so we do dorsiflexy and plantar flexion, so we kind of bend your ankles up and down. So you want to have it down like a gas pedal and then up like you're trying to bring your toes closer to your chest. And then what we do is that we go at your ankle and you go in, out, and we want to repeat these 5 times. Just for the sake of the video, I'm just going to do it once just to show what I'm trying to do. And then from here, what we're going to do is that we're going to have you lift your leg up. So you'd go from here, you go 1, 2, 3, 4, 5, and then you would try to push it out as well. So out towards the body, 1, or out from away from the body. So 1, 2, 3, and you go back in. So that's what we would want to do. And then lastly, what we're going to do is we're going to bend your knee, kind of have your knee up to your stomach and then back straight. And these are key to have you do, just so that way you don't, like I said, you don't atrophy up. So kind of going over those. I know that was a lot of education to give you, James, but these are very key, especially for your post-op. So just some things that we want to go over. We can kind of go over any of those things if we need to, providing education again. But just like I said, we want to try to do those. We want to use the incentive spirometer as well. That's another thing that I forgot to mention. And using that, what we want to do is that you want to kind of blow into it, and you want to try to blow into that 10 times within the hour, just to kind of help with expanding those lungs. So you can do it kind of through commercial breaks. Every time a commercial comes on, you just kind of in, and then just kind of keep repeating over and over again. This is so key to do to help with your recovery, and also just to kind of prevent you from getting anything like pneumonia or any issues with breathing, and to prevent that. Okay, otherwise I'm going to help you back into bed. We're going to kind of get you comfortable, and then I'm going to go ahead and kind of just document this education again. I'm going to wash my hands as well as I'm talking to him. James, if you ever need more to be re-educated on this, I know that was a lot, we can always go through it again. Okay, alrighty, I'm going to go ahead and document this, and I'm going to place the call light within his reach, and go ahead and document this.